there are many, many causes for abdominal pain, and it is down to the doctor to work out from taking a history and doing a good examination as to what that cause is. Causes for tummy pain can range from something to do with your bowels, your intestines. It can be due to your sort of kidneys or your bladder, or it can even be, obviously with females, your gynecological organs. So we have to think about all of those particular organs that are in the tummy, in the abdomen and pelvis. But also it might even be a general generic systemic illness that might be causing your tummy pain, such as diabetes. So it really does need a very detailed history and examination. The list is too long to list on this video, but certainly patients who have recurrent tummy pains, we're looking for specific things in the history which will guide us to specific sort of causes and investigation that we needed. Say, for example, if the pain's in the upper tummy, we're thinking more about troubles with your stomach or with your gallbladder, your pancreas glands, whereas lower down pains, we're thinking more about issues with your bowels, your large bowel, constipation, difficulties with diverticular disease, little pockets in the bowel, or appendicitis. And if you're getting lower towards the pelvis, you're even thinking of sort of gynecological causes in lady, like ovarian abscesses, twisted ovaries, infections, waterwork infections, or troubles with sort of the uterus. And again, it could be to the flank, and then you might be thinking more about kidneys or kidney stones. So one of the important things is where it is, and that gives us a start of a guideline. The next thing we'd be questioning is sort of what symptoms, what type of pain is it? Is it like a generalized colicky sort of tummy pain in the middle of your tummy? And then we're thinking more about, you know, bowel symptoms, because often you start with just sort of vague discomforts, but then they might migrate to a specific part of your body. Like if they go to your lower right hand side, it could be appendicitis, or on your left hand side it could be diverticulitis. Similarly, if it's an excruciating sharp pain that radiates down into your sort of groin, that might be, you know, you might suggest it's sort of like a kidney stone or something like that. Or if it goes through to your back, it might be to do with pancreatitis or inflammation or gallstones. So again, we're looking even at the pain, where it is, and what type of pain it is, and the nature of it, what sets it off and what relieves it. We want to know about your bowel function. How often are you opening your bowels? Has there been any change in your bowel habit? Have you noticed any blood within your stools? You know, patients, you know, can come in with, you know, infections, gastroenteritis, diarrhea, and just have vague tummy pains to start off with. But if it's all associated with fevers and being unwell and diarrhea, you'll, you know, be walking down that route. Similarly, they might not have any bowel symptoms. They might have troubles with their waterworks, passing urine. They might have burning, stinging, or blood in their urine that they've noticed, and again, that'll take you the other way. Or for ladies, you want to know about their menstrual cycle. Are they having any intermenstrual bleeding or discharge? So all of these things all are specific just to your tummy pain symptoms. So we'll always take all of those, and then followed by that, we need to know about your general health. Have you had any fevers, temperatures? Have you got any, you know, just feeling lightheaded, unwell? Have you been losing weight? All of those, again, will sort of guide you in one direction or the next. And that's just about the symptom of the tummy pain. And then we need to know about you as an individual. What is your medical history? Do you have diabetes? Do you have troubles with your thyroid gland? Have you got rheumatoid arthritis? Have you ever had any issues with your tummy before? Have you had any surgery in your tummy? Because a lot of patients who've had operations on their tummy can have scar tissue in it, and then the bowel can kink and block on that. And one of the commonest causes of bowel obstruction is simply scar tissue. Have you ever had a hernia? Have you got, operations in your groin? All these things are sort of relevant to, again, the tummy pain. We need to know what medications you're on. Some medications can sort of aggravate tummy pains or bowel symptoms. We'll look at all of that, and then we'll even it's important to know your family history. Has anyone else in the family had troubles? Is there a history of specific types of cancer? Have they had troubles with gallstones? Or so all these things are relevant to that tummy pain. And once you've taken a detailed history, the next thing would be the examination. And again, it is looking at the patient as a whole. Firstly, looking at their, have they got, are they sweaty, clammy, unwell? Is this an acute problem, or has this been a sort of chronic thing that's been going for quite a long time? Are they well nourished? Have they lost lots of weight? Are they thin, or are they overweight? Could they have other causes for that tummy pains? And so that clinical examination is important. Just standing at the end of the bed and looking at them, or the bedside, in the clinic. Then you'll look at for peripheral signs of specific disorders. We'll look in their eyes and their mouth. Have they got ulcers? Anything, jaundice, when the whites of the eyes are yellow. All of those will guide you towards sort of symptoms specifically with your tummy pain before you even examine the tummy and the abdomen. It's about feeling for lumps, looking at whether they're blown up, looking in their groins for hernias, making sure there's nothing tendinous around the back, and sort of getting a general feeling for their abdomen and their pelvis. So all of that all comes into sort of painting a picture and sending in the right direction as what the cause of that tummy pain is. And about 90% of your sort of diagnosis will be made just simply on that history and examination. You'll have some bedside tests or tests that can be done in the clinic, like they might dipstick the urine to see if there's any blood in it or if there's any signs of infection. They'll probably take your blood pressure and pulse to make sure there's no signs of infection or sort of you're just being generally unwell. And then once you've got all of that picture, you're kind of generally guided in a certain direction in terms of what investigations you need. Often in terms of investigations, we would start with blood tests, and those blood tests we'd be looking for signs of infection on your blood count, signs of anemia with a low blood count in terms of your hemoglobin levels. We'd look to check maybe if your liver's working all right or your kidneys working all right, and just some general markers of inflammation. We would, again, with that, we'd often need some sort of radiological investigation. The most straightforward one is an X-ray, an abdominal X-ray. And if we thought you might have a blockage in the bowel, that would be the first test. That would usually that's done in an emergency setting. Most of the time when we see people who've had some more chronic pains, it'd probably be a scan, either an ultrasound scan or a CT scan. An ultrasound scan is absolutely great for looking for things like gallstone disease, looking for kidney stones or sort of inflammation, or the pancreas gland, whereas a CT scan we probably use to give us a bigger picture and give us a bit more information, and is the next sort of step on from an ultrasound scan. A CT scan does involve X-rays, so it has a slightly higher risk than an ultrasound scan, so you might hold that back in certain patients. And then finally, if the CT scan hasn't given us all the answers, we also can use MRI scans to look for tummy pain. It gives us very specific views looking around the liver and the gallbladder, or even looking specific for specific issues with the small bowel, or even if we're looking in the lower bowel, in the rectum or the anus, again, we can look for very specific things depending on how we're sending our investigations. So lots of people struggle with tummy pains a lot of the time, and if we're honest, about a third of patients we'll see in hospital with tummy pains we may never find a cause, and so there is certainly, if you have a mild tummy pain and you're not acutely unwell, it is not unreasonable to see how things go. But if you feel very unwell and it's associated with other symptoms like a high temperature, just feeling weak or unable to eat and vomit, then definitely it's a time to seek help in the acute setting. Then there are also those patients who just recurrently get tummy pains, and they may be specific triggers, like you get tummy pains after eating, you suddenly get a pain in your upper tummy, and again, that would be a point where I would recommend that you do need to seek help if this has been going for a period of time and hasn't been getting better or is getting worse. Similarly, if you've noticed some tummy pains, but it's also been associated with some other symptoms, like you've noticed that your bowel habits change, you're now getting diarrhea, or you're struggling to open your bowels, you're constipated, or you've noticed some blood in the stool, then these are all much more strong and powerful symptoms and relevant than just a vague tummy pain on a one-off basis. So you need to be sensible. You need to think about your own self and how you are medically. And of course, if you're worried at any point, you should see a doctor, whatever it is, even if it's a little tummy pain. But generally, I would recommend, if it is a very severe pain, of course, an urgent visit is required. It may be even to go to an acute hospital. But if you're getting recurrent symptoms that are not going away, then that is probably a time to be investigated by a specialist in this area. So temporarily, you're talking about symptom control. So that's going to be pain relief in the first instance. You have to watch that, depending on some painkillers can aggravate certain types of sort of tummy pains, like the basic painkillers. We often talk about paracetamol or non-steroidal medicines like ibuprofen and Voltarol, but certainly ibuprofen and Voltarol can help, can thin the lining of the stomach and they sort of exacerbate some sorts of tummy pains. But simple painkillers, in terms of paracetamol, maybe some codeine-based ones, are not unreasonable. But once you're going beyond that, you'd certainly need a clinician's input into that. You need to make sure that you're eating and drinking well, making sure that you're well hydrated. Even some people find like a hot water bottle can help, but usually if you're still struggling with pains at that point, you probably need to seek sort of professional help. And once you're at that point, relieving tummy pain really needs to be done by diagnosing the cause of it and treating that. And that very much depends on where you're going with your tummy pain and what the problem is. So absolutely, surgery can be necessary to treat abdominal pain, and it very much depends on what the cause of the tummy pain is. Any blockage within the bowel that has caused colicky abdominal pains and distended tummy and vomiting often leads to surgery to sort of treat that, and that usually is done in the emergency setting. Occasionally is done sort of semi-electively. Patients who have trouble with gallstones might need their gallbladder removing. Patients who have hernias, they might need surgery to fix those, or any bit of bowel that gets twisted. Some patients who have tummy pains due to inflammation in the intestine occasionally need surgeries. People with Crohn's disease or ulcerative colitis, it can eventually, if medical treatments don't work, need an operation. Similarly, if you could have troubles with your gynecological organs, like an issue with a cyst or a twisted ovary, that again might need urgent sort of surgical input from a gynecologist. And in terms of sort of urological problems, you might not necessarily need an urgent operation for a kidney stone, but sometimes they can cause a blockage in the system, in the ducts, and that might need to be relieved with a drain done sort of inserted sort of radiologically, or you might need an urgent operation to sort of take that stone down. Again, it's usually the last resort, and a lot of sort of severe tummy pain that needs an operation is done in the emergency setting. But if the underlying cause of the pain is something like a bowel cancer, you might need a planned elective operation down the line. And definitely one of the reasons why you'd be referred to see a general surgeon like myself is for tummy pain, because often the definitive treatment is an operation performed by a general surgeon like myself.